Hello, everyone. This is Dr. Mike, and welcome to day 2 of how to make your medical exercise training practice referral ready in 30 days. Now, folks, we're doing this on a Saturday morning. This will be our only Saturday meeting. And I have to be honest with you, I'm going to need to present this material quick because today we're having a birthday celebration for my wife. Her birthday is next Thursday, and this afternoon we're having a cookout. So we decided to do this segment this morning, but we're going to do it quickly. And this segment will talk about the elevator speech. I know for many of you out there, you're trying to deal with doctors and therapists and chiropractors and get referrals. And sometimes you get tongue tied. You don't know what to say when you're talking about what you do and what types of clients you work with. You make it too much, you make it too little, you get a little bit shaky. So with that, we're going to talk about the elevator speech today. So with that, this is day 2 of our 30-day challenge on how to make your medical exercise training practice referral ready. So let's start with the elevator speech. Now, 2 things. Number 1, our Cracking the Code manual is available now. Now, this is the ultimate guide to insurance reimbursement for medical exercise specialists. It walks you through the whole process. It is 398 pages of information, including forms, guidelines, procedures, and billing codes, both CPT and ICD-10 codes. And then also our Advanced Medical Exercise Specialist Manual, which is the medical exercise professionals operating guide in building a medical exercise training practice. We have a special offer. If you take our webinar, you can get these 2 as digital downloads for $199. Now, folks, I showed you the 2 hard copies. Folks, I guarantee you the digital copies are better because number 1, they can be updated. Number 2, you could take them any place on your cell phone, on your iPad. So whenever you're working with clients, you can always reference them. And with these, as I said, we update these periodically, so you'll get the updates. And with that, we also have some media connections where you could actually click on links in these digital manuals and actually go to video segments. So with that, let's go ahead and get started. Number 1 thing we always need to talk about is the scope of practice of the medical exercise specialist in your role. And that role is to provide medical exercise training assessments, cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education, aquatic training, and stabilization training. Now, it doesn't say anything about soft tissue mobilization unless you're a licensed massage therapist. It doesn't say anything about electrical modalities, electric stim, ultrasound, and it doesn't say anything about hot packs or cold packs because by law, folks, you can't provide these. This is your legal scope of practice. With that said, let's talk about this elevator speech. Now, the elevator speech is very simple and straightforward. As a physical therapist, I had to have an elevator speech when I went in to talk to a physician. You would say, well, Dr. Mike, don't physicians know what you do? You'd be surprised, some don't. And some physicians, therapists, and chiropractors have never heard of a medical exercise specialist. So you need to have an elevator speech. And that elevator speech should go over 4 things: who you are, what you do, how you do it, and who you do it to. They don't know who you are in many instances, folks. You got to explain that to them, and you've got 30 seconds to do it in this elevator speech. So this elevator speech isn't only for when you go in and you meet a doctor, therapist, or chiropractor, but also let's say you're at a social event. Let's say you're at a dinner, like a birthday party, and you meet some folks there, and they ask you what you do. You're trying to explain it. Use your elevator speech. And with that, we even have a script of an elevator speech. This is one I developed, and we've used this one as the standard elevator speech for all of our medical exercise specialist marketing courses. Hello, my name is Michael Jones. I'm a medical exercise specialist. I develop medically based exercise programs for individuals with medical conditions following discharge from physical therapy or occupational therapy. I use structured exercise without any medical treatment or modalities to improve flexibility, strength, endurance, stability, balance, coordination, and overall function for daily living. I most often work with clients recovering from total joint replacements or managing neurologic conditions such as multiple sclerosis, Parkinson's disease, or post-stroke recovery. Now, folks, that's it. Who you are, what you do, how you do it, who you do it to, in a very simple and succinct manner. Now, some folks still won't get it. So if you're in a doctor's office or a therapist's office and they still aren't clear, then use a scenario. Dr. Smith or therapist Susan, have you ever had a patient that you work with after a stroke or a total joint replacement or a surgery, or they have a long-term condition, and you've provided services to them, you've referred for physical therapy and occupational therapy, you've done your medical treatment, and they get to a plateau and they just can't get any farther? The insurance carrier is not going to pay for anymore, and they're stuck right there, but they want to go back and do more things. You know they're capable, but they need more therapy, but it's been discontinued. Dr. Smith or therapist Denise, excuse me for messing up the names. I'm the person you refer to, and we'll use a structured, specific, focused exercise program to get them back as close as we can to their previous level of function. I'm that person. Now, for the medical professional, they get that. But also, let's say you're at a dinner party or you're at a social event and someone asks you what you do. You say, well, you ever had an aunt or uncle that had a stroke, or maybe they had a hip replacement and they just couldn't get back to where they were after physical therapy, occupational therapy? I'm the person that designs the exercise program to get them back to where they were. Folks, you use the elevator speech to explain who you are, what you do, how you do it, who you do it to. And then you use that extra scenario to give them a picture of, oh, yeah, I had an aunt that did that. Oh, yes, coming from a doctor or therapist, we've had a couple of patients that they get to a certain point and they need more, but the insurance carriers cut them off. We now can refer them to you. So this elevator speech opens the door. And I know many of you, you're overwhelmed. You're talking to the doctor, the therapist. You're thinking about your scope of practice, all the exercises you do, everything you do. Folks, this boils it down into a simple elevator speech. So this is the primary elevator speech. The scenario I talked about is the add-on if they don't quite get it, and it works. We've used this for 31 years. And folks, I used a version of this as a physical therapist when I would go in and see physicians. And not every physician understands physical therapy, which means, folks, I know not every physician, physical therapist, occupational therapist, chiropractor quite understands medical exercise training. So please use it. With that, we're going to drop in the chat. Let me do it right now. We're going to drop in the chat here a copy of a template that you can use. Now, this template is in Microsoft Word, which means all you got to do is open it up in Microsoft Word, and you can type in your information, and it's good to go. Now, if you're watching this, there should be a link down below, or email me at drmike@postrehab.com, and we will send you the elevator speech template. It's a simple template. You type in your information, you're good to go. Now you use this and you get to the point you practice it in the mirror in the mornings, practice it in the mirror in the evenings when you take a shower, you get ready to hop into bed after a long day, and eventually gets to the point it just rolls right off your tongue. Now, this program, our 30-day challenge, is sponsored by our Medical Exercise Specialist Network. We're revamping and we're relaunching the network on May 22nd. So please watch for the email that we'll send you to join on May 22nd. And with that, folks, make sure that you register for our Cracking the Code webinar series. That's an ongoing webinar series. Now, we have this 30-day challenge, but every Friday we meet and we talk about a specific topic that's necessary for you in cracking the code to build a strong and profitable medical exercise training practice. So with that, thank you for joining us. It's Saturday. This will be our only Saturday. Meet back with us again on Monday, and we'll have step number 3 in the journey to building your medical exercise training practice and making it referral ready in 30 days. So thank you for joining us. Again, if you want to get the copy of the template, please email me at drmike@postrehab.com. Thank you again. Have a great remainder of the weekend.